Hello everyone, welcome to my class today. Today we'll see the next topic, that is impact of illness on patient and family. So first we have to know the definition of illness. So illness is a highly personal state, a subjective feeling of being unhealthy or sick. Okay, so in the last classes also we have seen. So illness means if a person is feeling sick or unhealthy, the experience he is having, that is called as illness. Okay, and illness will differ according to the person's nature and their way of reacting to the disease. And next is patient. So patient is a recipient of healthcare services who is often ill or injured and in need of a treatment from a healthcare provider. Okay, so the person who is coming to hospital, so that is called recipient, and he wanted healthcare services. Services is called as patient. So next, coming to the impact of illness on patients. So there are mainly four impacts. First is impact on behavior and emotions. Okay, so whenever a person is sick, his behavior and emotion, that is, he will have so many problems in the mind and his behavior will change. And next is impact on body image. So body image means, so whenever a person is in a chronic illness or in some debilitating condition where he is losing some limb or a leg or a hand, then he will have some changes in body image. So he will feel shy to go around the places. Okay, and next is impact on self concept and self esteem. Okay, a person may be a very rich man and he is a very posh man in a society, but when he is sick he has to get help from the other person, so he becomes dependent on someone, and thereby self esteem and self concept will be lost. And next is lifestyle changes. So whenever person is sick, mainly chronic illness, they have to make so many lifestyle changes. For example, maybe they have to live in they have to go in a wheelchair for long, or they have to take lifelong medications, they have to go for a walk, they have to go for running every day. So like this, so many lifestyle changes can happen. Coming to the first impact is the behavioral and emotional change. So this is the impact seen in the patient mostly. So this impact will be different according to the type of illness. Okay, so first is nature of illness. Okay, in case it is a short term illness, there won't be much behavioral change, whereas in long term illness, patient will have so much anxiety, emotion, and changes in emotion, changes in behavior. So all those things will be in long term illness. And client's attitude towards illness. Some show behavioral changes like anger, shock, denial, anxiety, and withdrawal. Okay, sometimes when we say some diseases like cancer or some chronic illness, okay, patient immediately will go in a shock or denial, means he will say, no, no, I cannot get the disease. How come I got the disease? So like that he denies, and certain time he'll be in a shock. Okay, suddenly hearing about cancer, he goes into a shock, or some tension goes in the mind. Okay, and then he becomes anxiety or fear related to the disease and withdrawal. Okay, so once he knows that he is disease, then he starts withdrawing himself from family, and he doesn't want any to make any social relationship, because he will have a feeling that some persons will think wrong about him because he got the disease. Okay, and client support, and also behavioral changes will be based on the client support system. Okay, so in case if there is a good relations in the family to look after him, to care him, then the persons, like in case parents are there, family members are there, any friends or any caregivers are available, then patient will not have much behavioral changes. But if there is none, then the person will have so many problems to take care of himself. So he will be disturbed both emotionally and in behavior. Okay, secondly, the patient can have body image disturbance or impact on body image when he is having illness. So first is rapid weight loss or weight gain. Okay, suddenly some medications like steroids will increase the weight of the person, and some disease conditions like tuberculosis, etc., will lose the weight of the patient. So when there is weight loss or weight gain, again patient will have disturbance in body image. And limited or lost mobility. Okay, as any orthopedic conditions, when the bone is damaged, then the person will have limited movement, or he may not have movement, and he has to be imposed in bed rest. Okay, so that time his body image can be disturbed. And altered or lost body function. Okay, that is when patient is unconscious or semi-conscious and he cannot do any work. There will be losing body functions, that is, he cannot do the activities of daily living. And sometimes patient will have scarring or loss of body parts. Okay, so this is in case of burns, Patient body will get scarred and he'll be black tissue will be there, and there can be contractures present in the body. That means the skin get pulled, and these all are some body changes which can impact the body image of a person. And next is changes in skin color. So skin color, certain medications or certain diseases of the skin like psoriasis, etc., they can change the color of skin color, so the person's body image can be disturbed. And finally, hair loss. So some diseases like cancer, where patients go for chemotherapy drug, chemotherapy treatment, there can be hair loss. So when hair loss is there, again patient's body image can be disturbed. Next, impact on self concept and self esteem. So illness itself will have negative impact on the person as they experience pain, discomfort, and changes in appearance and loss of control over their own bodies. Okay, so whenever the person is ill, they get confined to bed and they think their energy, everything is lost. So they don't feel like doing any activity, and also because of their body image and everything is changed, they have a change in their self concept. Because of the poor self concept, there will be low self esteem. Okay, that is because the patient is not able to do the work and he is in chronic illness, and he will be in a disease focused world, so he will not maintain any social relationships or any interaction with other people, because maybe he is in a good position previously, but after the disease, because his job is lost and everything would have lost, so he will not maintain good relationship and he will only think about the disease. That is poor self-esteem, that is low self-esteem, which will impact the patient during illness. The impact of illness on client, the client's personality and lifestyle will change. Okay, so whenever some chronic illness is there, patient has to make some lifestyle changes. So when there is lifestyle changes, then he will have some changes in his personality. So first is nutrition or diet. So in some cases, patient may come home with a rice to feeding or gastrostomy, jejunostomy feeding. Okay, so at that time he has to make changes in the diet. And sometimes patients with any stroke or any heart attack, patient has to cut down the cholesterol. So at that time, so according to that, if salt restriction, protein, if we have to increase, so according to the diseases, his dietary pattern will change. And habitual practice is something like smoking or alcoholism. So if a patient is having some habits like that, he has to cut down those habits in some diseases. And activity changes. Okay, so mostly in certain diseases, doctors will advise them to go for yoga, meditation, and to do a regular exercise. In such conditions, patient has to go for a walk or running, jogging, etc. And same way role changes. So in case if patient is a breadwinner of the family, then he has to change his role. Some other one has to look after that role, and he has to change the role. That is, he cannot go for occupation, etc. So his personality or lifestyle may change. And finally, there can be therapeutic changes. So like for example, if a patient is having diabetes mellitus and is advised to go with insulin therapy, then the person has to learn how to give insulin therapy. Likewise, they may advise them for oxygen nebulizer therapy, and so many changes he has to make when he is at home. So these are the impact of illness on patient. Next, coming to the impact of illness on family. So family is a social group consisting of parents, children who live together as a unit and maintain interrelationship with each other. So because family is a unit, so whenever one person in a family is sick, the whole family will get affected. So we'll see what are the impact in family. First, there is impact in the family role. So in family, each one has a different role, like breadwinner, professional, child, sibling, parent. So like that, the person will have some role. So when a person is sick, this role reversal occurs. Okay, so that means some other person in the family has to take up the role of the sick person. So at that time, there will be so many adjustment problems, stress within the family. So there must be some coping or guidance or counseling should be given to this family in order to cope with the situation. Next is impact on family dynamics. So family dynamics is a process in which the family functions, make decisions, give support to family members, and copes with everyday changes and challenges. So in case of illness in a family, the full family dynamics will change, and this can cause some problems in the relationship of the family. Yeah, especially when a couple is living in a family and one person is getting admitted in the hospital, the other person has to stay at home. There will be loneliness, and they have to take decisions on their own. So these are all some changes in the family dynamics which can affect during illness. Okay, the final impact is the impact on socio-economic status of the family. So healthcare is nowadays a huge cost in the family, and it also causes major burden to the family. So when a person is in long-term illness, especially if he has to go for a dialysis or he have to go for treatment again and again, the person cannot meet the cost of the illness. This can also lead to changes in the career development or affect the career development of other person. So, for example, if a person is a breadwinner of the family who is sick, then the whole family will not have money to food, and then they don't have money for education. So, because of that, career development will get spoiled. So, because of that, there will be more stress in the family, which results in adjustment problems. So, these are the impact of illness on patient and family. I hope you understood. Thank you.